Sides of the neck. Sides of the neck. Posterior triangle, anterior triangle, submental triangle, and back. So sides of the neck, you have to know it because these are the main thing in the neck to know the landmarks. Posterior triangle of the neck. This is the posterior triangle of the neck. This one. This is the posterior triangle of the neck. It is posterior border of sternocleidomastoid muscle. This muscle is known as sternocleidomastoid muscle or sternomastoid muscle. So this is the anterior border of this triangle. It is the posterior border of sternocleidomastoid muscle. And this muscle is known as trapezius muscle. So anterior border of trapezius muscle, this is the posterior border of the posterior triangle of the neck. Base, this is the clavicle, intermediate part of the clavicle. Floor, deep fascia, prevertebral fascia, covering by muscles of the floor and four muscles from below, scalenus medius, levator scapulae, splenius cubitus, and semi-splenius cubitus. Roof of this floor, skin, superficial fascia, deep fascia, infesting fascia of the neck, split to cover the trap, and divided by the inferior belly of ommohyoid. This is ommohyoid muscle, inferior belly of ommohyoid muscle. This is the ommohyoid muscle. Ommohyoid muscle. It is divided by the inferior belly of ommohyoid muscle into large occipital triangle and small supraclavicular triangle. So this is the posterior belly of ommohyoid. It divides this triangle with the posterior triangle to the supraclavicular triangle. This is the supraclavicular triangle. And this one is the large occipital triangle. So this is the posterior triangle of the neck. Posterior triangle of the neck divided by inferior belly of the gastric. This is the inferior belly of the gastric. To this area, supraclavicular triangle. And this area is known as occipital triangle of the neck. And this area is known as supraclavicular triangle. So this is the supraclavicular triangle, and this one supraclavicular fossa, supraclavicular triangle, and the whole area is the occipital triangle. Sternocleidomastoid muscle. This muscle is so important because we say it is the keystone of the neck, this muscle. Huge, large muscle. Sternocleidomastoid muscle or sternomastoid muscle. The sternocleidomastoid muscle is the key muscle landmark in the neck. All of you have to know all what's contained this muscle. The sternocleidomastoid muscle is a broad, strap-like muscle that had two heads. So it has two heads, this one head and this head. This one is clavicular head, and this is the sternal head of the sternocleidomastoid muscle. The round tendon of the sternal head attached to the manubrium. Attached where? To the manubrium. And thick fleshy clavicular head. This is the fleshy clavicular head attached to the superior surface of the medial third of the clavicle. The two heads of this muscle separated anteriorly. They are separated from each other anteriorly, where there is a supraclavicular fossa. So this fossa is known as supraclavicular fossa, bounded by anterior belly anterior part of the sternocleidomastoid muscle. That is the sternal part, and posterior part of sternocleidomastoid muscle. This is the clavicular part, known as supraclavicular fossa. The head join to each other, so they are united to each other and attached to the mastoid muscle up. So inserted to the mastoid process of the temporal bone and the superior nuchal line of the occipital bone. So to superior nuchal line as well as the mastoid bone. The infesting layer of the deep fascia split to form the sheath of the sternocleidomastoid muscle. Action, what there is action? When one muscle contracted, when one of them contracted, it blends the head toward the same side and turn the face to the opposite side. So contraction of one part of the muscle, it will bend the muscle to the contracted muscle. and also turn the face to the opposite side. When both of them act to each other, they will flex the whole neck. Muscles of the anterior cervical region. So the main muscle is sternocleidomastoid muscle. But when we talk about the muscles of the anterior cervical region, the anterior lateral part of the neck, the hyoid bone, provide attachment of the suprahyoid muscles. So we have suprahyoid group of muscles. They are attached to the hyoid bone. Superior to it, the infrahyoid muscles, inferior to it. This hyoid bone muscles steady or move the hyoid and larynx. For description purposes, usually we divide the group to suprahyoid muscle and infrahyoid muscle. The suprahyoid muscles and infrahyoid muscles, they are a group of muscles. These are suprahyoid group, myelohyoid, genohyoid, stylohyoid, and digastric muscles. These are the suprahyoid muscles. Myelohyoid, genohyoid, stylohyoid, and digastric muscles all act as a one group, the muscles working to each other. And there are two parts of the gastric muscles, has two heads, because the gastric muscle have two heads, joint in the intermediate tendon and descend toward the hyoid bone, fibrous link derived from the pretracheal fascia and forming this part of the muscle. It is connected to this tendon, the body of the greater horn of the sphenoid. The infrahyoid muscle, called strap muscles, because of their ribbon-like appearance, and inferior hyoid. These four muscles anchor the hyoid sternum, clavicle, and scapula, and depress the hyoid and larynx during swallowing. They are work within the suprahyoid muscles to steady the hyoid bone. So we have already finished with the muscles of the posterior triangle. As we say, there are many muscles, infrahyoid and suprahyoid muscles. As we say that infrahyoid muscles, there are two groups, superficial group and deep groups. The infrahyoid group are superficial plan made of sternohyoid muscle and omohyoid muscle, and deep plan composed of sternothyroid and thyrohyoid muscles. The sternothyroid covers the lateral loop of thyroid gland. The sternothyroid cover the lateral loop of the thyroid gland. It is attached to the oblique line of the lamina of thyroid cartilage, immediately superior to the gland, limited upward extension of an enlargement of thyroid gland. So if there is an enlargement of thyroid gland, it will not come up because the attachment of sternothyroid muscle. Vessels of the posterior triangle. Third part of subclavian artery. So we have the subclavian artery, the third part of subclavian artery. These are branches, the third part of the subclavian artery. No branches. Transverse cervical, branches of thyrocervical trunk, supraclavicular vessels, brachiothyrocervical trunk, and external jugular vein. So we have the external jugular vein, we have the third part of the subclavian artery, there is no branches. The transverse cervical, branch of thyrocervical trunks, branch of thyrocervical trunks, which is the inferior cervical artery, and also artery going to the chest as the internal thoracic artery. External jugular vein. These veins are important for us. External jugular vein, which we say that it is formed by posterior part of the branch of the posterior facial vein and post-auricular vein. This is the external jugular vein. It is formed by the union of posterior auricular vein with the posterior division of posterior facial vein inside the parotid gland. These are the external jugular vein. The vein pierces the deep fascia of the roof of posterior triangle to open into the subclavian vein. So where the external jugular vein go and to the subclavian vein. The external jugular vein has three tributaries: anterior jugular vein, transverse cervical, and suprascapular vein. Anterior triangle. So we finished already with posterior triangle, we come to this triangle. Anterior triangle of the neck. The anterior border of sternocleidomastoid posteriorly. So sternocleidomastoid form the anterior border of the posterior triangle and form the posterior border of the anterior triangle of the neck. This is the triangle of the neck. So posterior border of the triangle is formed by anterior border of sternocleidomastoid muscle. Base in the of the anterior triangle is the mandible. This is the base of the triangle. And anterior, it is the midline of the neck. So triangle, base of the mandible, anterior border of sternocleidomastoid muscle, and midline of the neck. Subdivision of the anterior triangle. This triangle is divided to other triangle: digastric triangle, carotid triangle, muscular triangle, and half of the mental triangle. So this is submental triangle. This is the half of submental triangle. And this is the carotid triangle because of the carotid artery. And also this one is the muscular artery and muscular triangle. So anterior triangle have digastric triangle, carotid triangle, muscular triangle, and half of submental triangle. Boundaries of this triangle, we say it is part of the anterior triangle. This is the digastric triangle. Anterior belly of digastric, this is part on, posterior belly of digastric, and base of the mandible. This is the digastric triangle. The floor is formed of mylohyoid and hypoglossal muscle. This is the digastric triangle. What are the content of the digastric triangle? This is the main thing, submandibular gland, submandibular salivary gland, submandibular lymph nodes, part of facial artery, anterior facial vein, and part of hypoglossal vein. This is the digastric triangle. Boundaries of carotid triangle: anterior border of sternocleidomastoid muscle, posterior belly of digastric muscle, superior belly of omohyoid muscle. So superior belly of omohyoid muscle, anterior border of sternocleidomastoid muscle, and posterior belly of digastric. The floor formed of hyoglossus, thyrohyoid, middle constrictor, inferior constrictor of the pharynx. Content of the carotid triangle: carotid sheath, this is the main one, and you have to know the carotid sheath. This is the carotid sheath. Carotid sheath, and it is content: common carotid artery, and it is continuation. Common carotid artery, and it is continuation. Internal carotid artery, internal jugular vein, vagus nerve, and also sympathetic trunk to the sheath, posterior to the sheath. So sympathetic trunk outside the sheath, and ansa cervicalis, anterior to the sheath. So posterior to the sheath you have sympathetic trunk, anterior to the sheath you have ansa cervicalis. In addition of the carotid sheath, the carotid triangle contains external carotid artery and the origin of some of its branches. These are the boundaries and content of carotid triangle. Boundaries of the muscular triangle: superior belly of digastric muscle, anterior border of sternocleidomastoid muscle, middle line of the neck, the floor formed of infrahyoid muscle. Infrahyoid muscle, it is sternohyoid, sternothyroid, superior belly of omohyoid, and thyrohyoid muscles. Ansa cervicalis, which lie to anterior to the sheath. Ansa cervicalis, it is the nerve loop. This is the ansa cervicalis. This is loop. It is the nerve loop formed by union of descending hypoglossal, C1, and descending cervical. So it have two forms: descending cervical and descending cervical. This is the descending cervical, and descending hypoglossal. This is the ansa cervicalis. Hypoglossal is the one of the cranial nerves. The ansa cervicalis arises from 1, 2, 3 cervical, from first and second and third cervical, and it gives nerve to omohyoid, nerve to sternohyoid, and nerve to sternothyroid muscles. C1 give also nerve to thyrohyoid and nerve to genohyoid muscles. That is the ansa cervicalis. We'll talk about submental triangle. What are the boundaries of submental triangle? Anterior belly of digastric on the right side, anterior belly of digastric on the left side, and hyoid bone. These are submental triangle. Anterior belly of digastric on the right side, anterior belly of digastric on the left side, and hyoid bone. The floor is formed of myelohyoid muscle, and it is rough. What are the content of submental triangle? Submental lymph node and submental veins. Back of the neck. Back of the neck, this is the last slide. Back of the neck. It's formed of 4 layers. First layer consists of trapezius and latissimus dorsi. Second layer consists of levator scapulae, rhomboid major, serratus posterior, superior serratus and posterior, inferior, and splenius muscle. Third layer consists of erector spinae and semispinatus. Fourth layer constitutes of number of small muscles called multivator, rotatories, interspinous, interversus, and muscles forming the suboccipital triangle.